With COVID quickly spreading recently and the ramping up of spring allergy season, it might be hard to tell the difference between the two. We spoke with Dr. Ellis at Queen's University to get her advice on determining what you might be dealing with, especially if it's hard to get your hands on rapid tests. So, from your perspective, where are we at right now in terms of spring allergies and what can people expect in the coming weeks?
Yeah, so we're just getting started with springtime allergies. Certainly, snow mold has been out and causing havoc for quite a couple of weeks now. Once you lose a lot of that snow covering and that dead grass you see underneath is what causes those early symptoms. And we're just slowly but surely making our way into some of the early tree pollens. We'll really get going with a robust response by the end of April, when birch pollen season typically happens in Ontario. And then, of course, by May, we're into grass season and lots of potential triggers out there that can cause issues for people who suffer from springtime allergies.
Are there any clear differences between the symptoms of COVID-19 and spring allergies?
Absolutely. So again, springtime seasonal allergies present with symptoms like sneezing, runny nose, itchy, watery eyes, nasal itch. Occasionally, postnasal drip can lead to a mild cough as well. And obviously, you can see there's a lot of overlapping tick boxes when it comes to symptoms of COVID-19, particularly with the Omicron variant, often presenting with a milder form. So the clear differentiating features are, with spring allergies, you get itchy, watery eyes, and itching of the nose, pallor of throat. Those are not symptoms you'll typically see with COVID. COVID will also give you a sore throat, malaise, general feeling completely wiped out, and that's not so typical for allergies.
And if somebody's able to rule out COVID-19, what can allergy sufferers do to sort of mitigate the feelings that they're feeling?
Yeah, so we have lots of great safe and effective therapies for allergies now. Really recommending that people purchase the second generation or non-sedating antihistamines. They're more effective than the older ones that do cause sedation. There's many that you can choose from over-the-counter therapies, but also we have prescription non-sedating antihistamines that if you happen to have a drug plan, your primary care provider can give you a prescription for that to save you the out-of-pocket cost. Also, nasal corticosteroids, very quickly jump to those for first-line treatments as well. We do have some that you can just purchase over the counter, and then a myriad that can be prescribed by your doctor.
And I know some people might be apprehensive about using over-the-counter medications or prescriptions, that type of thing. Any natural remedies that you sometimes suggest to patients?
Yeah, so saline rinses can be very effective. So you see, again, lots of different choices in the pharmacy aisle for just saltwater solutions. Again, it is worth using the ones that you can purchase to make sure that they're sterile. So you're not trying to do your own home remedies, boiling water at home and adding your own salt. It is better to use the ones that have been prepared to good manufacturing practices.
For more on this story, go to citynews.ca. In Toronto for City News, I'm Nick Westoll.